Alzheimer's, the basics. Alzheimer's disease. It's a phrase that carries weight, evokes concern, and for many, hits close to home. Alzheimer's is not just a disease, it's a profound challenge that affects millions of families worldwide. This devastating disease gradually erodes a person's memory, thinking skills, and eventually, their ability to carry out even the simplest of tasks. Imagine forgetting the names of loved ones or how to perform daily routines. It's a journey that millions face, but understanding the early signs can make a world of difference. Early detection can provide a glimmer of hope in an otherwise daunting situation. You see, recognizing the subtle symptoms of Alzheimer's early on is crucial. These symptoms might include mild memory loss, confusion about time or place, and difficulty completing familiar tasks. Early diagnosis allows for timely intervention, which can potentially slow down the progression of the disease and provide individuals and their families with valuable time to plan for the future. This planning can include medical treatments, lifestyle changes, and emotional support. In this video, we'll delve into the often overlooked early symptoms of Alzheimer's disease. By understanding these signs, you can take proactive steps towards seeking medical advice and support. We'll explore the nuances of these signs, empowering you with the knowledge to recognize them in yourself or your loved ones. This awareness can lead to earlier interventions and better management of the disease. Remember, knowledge is power, and in this case, it could be the key to timely intervention and support. By staying informed, you can make a significant difference in the lives of those affected by Alzheimer's. Memory loss, beyond simple forgetfulness. One of the most common and often early signs of Alzheimer's is memory loss, particularly affecting recent events. This isn't just about forgetting where you left your keys, it's about losing track of important details that were just discussed or events that just happened. Imagine this. You meet someone new at a social gathering, have a pleasant conversation, and then moments later, struggle to recall their name or even the fact that you just met them. This can be incredibly disorienting and frustrating, not just for the person experiencing it, but also for their loved ones. For someone experiencing the early stages of Alzheimer's, this scenario might be a regular occurrence. They might find themselves frequently lost in thought, trying to piece together recent events or conversations. They might forget recent conversations, appointments, or important dates. This can lead to missed appointments, forgotten commitments, and a general sense of confusion about their daily schedule. Now, it's important to remember that occasional forgetfulness is a normal part of aging. Everyone misplaces items or forgets names from time to time, and this is usually not a cause for concern. We've all misplaced our keys or struggled to recall a name from time to time. These moments of forgetfulness are typically fleeting and don't significantly impact our daily lives. However, in Alzheimer's, memory lapses become more frequent and pronounced. These aren't just occasional slip-ups, they are persistent and interfere with daily functioning. The person might repeatedly ask the same questions, forget conversations entirely, or rely heavily on memory aids like notes or calendars. This reliance on external reminders becomes a crutch to navigate through their day. If you or someone you know is experiencing persistent and concerning memory problems, it's crucial to consult a healthcare professional for a proper diagnosis. Early detection is key. Identifying the symptoms early can lead to better management and support, helping to maintain quality of life for as long as possible. Planning and problem solving. The foggy maze. Alzheimer's disease doesn't just affect memory. It can also impair an individual's ability to think clearly, plan, and solve problems. This cognitive decline can be particularly distressing, as it impacts the very essence of daily living and independence. Tasks that once seemed routine, like following a recipe, managing finances, or even playing a favorite game, can become increasingly challenging. The steps that were once automatic now require intense concentration and effort, often leading to frustration and anxiety. Imagine trying to navigate a familiar route but suddenly feeling lost and unsure of which turn to take. This disorientation isn't just limited to physical spaces. It can also occur in mental processes, making it hard to follow conversations or remember important details. This sense of disorientation can extend to everyday activities for someone with Alzheimer's. Simple tasks like doing household chores or even getting dressed can become confusing and time-consuming. They might struggle to follow a sequence of steps, make decisions, or concentrate on tasks that require sustained attention. Even using familiar technology, like a computer or smartphone, can become a daunting challenge. For example, Balancing a checkbook, which was once second nature, might now feel overwhelming and confusing. The numbers and calculations that used to make sense now seem like an unsolvable puzzle. These cognitive changes can be subtle in the early stages, often dismissed as stress or simply getting older. However, they gradually become more pronounced, affecting the person's ability to function independently. However, if you notice a persistent and significant decline in cognitive abilities, it's essential to seek medical advice. Early diagnosis and intervention can help manage symptoms and improve quality of life, providing support and resources for both the individual and their caregivers. Familiar tasks, when routine becomes a challenge. As Alzheimer's progresses, even familiar tasks that were once second nature can become increasingly difficult. Imagine struggling to button your shirt, prepare a simple meal, or even operate a familiar appliance. These everyday activities can become daunting challenges for individuals with Alzheimer's. The disease affects the brain's ability to process information and execute motor skills, making it difficult to coordinate movements and complete tasks that were once effortless. Driving, for instance, can become particularly challenging and even dangerous. Spatial awareness, judgment, and reaction time are all affected, increasing the risk of accidents. It's important for family members and caregivers to be patient and understanding during these times. Offer assistance when needed, but also encourage independence whenever possible. Remember, maintaining a sense of autonomy and dignity is crucial for the well-being of individuals with Alzheimer's. Imagine feeling disoriented in your own home, unsure of the date, or unable to keep track of the passage of time. For individuals with Alzheimer's, confusion with time and place is a common and often distressing symptom. They might forget appointments, lose track of the day or week, and even wander off, unsure of how to get back home. This disorientation can stem from damage to brain regions responsible for memory, spatial navigation, and temporal awareness. It's essential to create a safe and structured environment for individuals experiencing these challenges. Establish routines, use visual cues like calendars and clocks, and ensure the home is well lit and free of tripping hazards. If you notice a loved one becoming increasingly disoriented or confused, it's important to seek medical attention. Chapter 5. Alzheimer's disease can also affect an individual's visual and spatial abilities, leading to difficulties with depth perception, object recognition, and spatial awareness. Imagine struggling to judge distances, misinterpreting visual cues, or having trouble recognizing familiar faces. These challenges can make everyday activities like reading, driving, and even walking around the house more difficult and potentially dangerous. For example, someone with Alzheimer's might misjudge the height of a step, leading to a fall, or have difficulty distinguishing between colors, making it challenging to follow traffic signals. It's important to be aware of these visual and spatial challenges and make adjustments to the environment to ensure safety. Remove tripping hazards, use contrasting colors to define edges and steps, and provide adequate lighting. Chapter 6. As Alzheimer's progresses, individuals may experience difficulties with language and communication. Finding the right words, following conversations, and expressing thoughts clearly can become increasingly challenging. Imagine struggling to articulate your thoughts, feeling like you're constantly searching for the right words, or having difficulty understanding what others are saying. This communication breakdown can be frustrating for both the individual with Alzheimer's and their loved ones. It's important to be patient, understanding, and supportive. Speak clearly and slowly, use simple sentences, and allow ample time for the person to process information and respond. Nonverbal cues like gestures and facial expressions can also be helpful in conveying meaning. Chapter 7. Misplacing belongings is a common occurrence for many of us, but for individuals with Alzheimer's, it can become a frequent and troubling symptom. Imagine putting your keys in the refrigerator, leaving your wallet in the freezer, or placing a burning candle in a drawer. These actions, while seemingly illogical, can occur as the disease disrupts memory, judgment, and spatial reasoning. Individuals with Alzheimer's might also have difficulty retracing their steps, making it nearly impossible to find misplaced items. This can lead to frustration, anxiety, and even accusations of theft. It's important to create a calm and supportive environment, avoiding blame or judgment. Establish designated spots for important items, use labels and reminders, and consider installing tracking devices on frequently misplaced belongings. We've covered a lot of ground today, exploring the often subtle signs of Alzheimer's disease. From memory lapses to challenges with language and daily tasks, this disease can manifest in various ways. Remember, recognizing these symptoms early is crucial. It allows for timely intervention, potential slowing of the disease's progression, and valuable time for families to plan and adapt. If you notice any of the signs we've discussed in yourself or a loved one, please don't hesitate to seek medical advice. Early diagnosis is key to navigating this challenging journey with the best possible support and resources. And don't forget to subscribe to our channel for more informative videos on health and well-being. Your health is your wealth, so stay informed and stay empowered.